Pulse oximeters are useful for people who have conditions that affect oxygen saturation. This provides the estimates of the arterial oxyhemoglobin saturation, or the SaO2, by utilizing the selected wavelengths of light to non-invasively determine the saturation of oxyhemoglobin. For the setting, the pulse oximetry must be performed by the trained personnel in a variety of settings, including hospitals, clinics, and at home. For the indications, the first one is the need to monitor the adequacy of the arterial oxyhemoglobin saturation. Next is the need to quantitate the response of the arterial oxyhemoglobin saturation to the therapeutic intervention or to a diagnostic procedure. Last is the need to comply with a mandated regulation or recommendations by authoritative groups. For the contraindications, the presence of an ongoing need of measurement of pH, PaCO2, total hemoglobin, and abnormal hemoglobins may be a relative contraindication to pulse oximetry.
Asthma is described as a lung disorder characterized by reversible bronchial smooth muscle constriction, airway inflammation, and increased airway responsiveness to an assortment of stimuli. During an asthma attack, the smooth muscles surrounding the small airways constrict. Over time, the smooth muscle layers hypertrophy and can increase to 3 times their normal thickness. The clinical manifestation of asthma include recurrent episodes of wheezing, cough, chest tightness, and shortness of breath. The symptoms are often worse at night or waking from sleep. Usually, they resolve spontaneously or with the inhalation of a reliever medication. Expiration requires effort and becomes prolonged.
The cause and effect of asthma. No one really knows what causes asthma. What we do know is that asthma is a chronic inflammatory disease of the airways. The causes can vary from person to person. Still, one thing is consistent. When airways come into contact with a trigger, they become inflamed, narrow, and filled with mucus. Asthma triggers are different from person to person, can include airborne allergies such as pollen, dust mites, mold spores, or particles of cockroach waste. These may lead to difficulty with exercise, sleep, and routine daily activities.
The normal value of oxygen saturation is roughly 95 to 100 in pulse oximeter, and in the case of severe asthma, it is 93, and in moderate asthma, it is 93 to 97. If the patient oxygen saturation become less than 93, it is highly suggested to use oxygen treatment for about 12 hours until the oxygen saturation become normal or stable, and pulse oximeter is a must to monitor the range of oxygen saturation.
So in pulse oximetry is often used to grade the severity of acute asthma. Oxygen saturation with above 97% constitutes only mild asthma, while 93 up to 97% constitutes moderate asthma, and less than 93% signifies severe asthma. So if the patient with an asthma pulse oximetry is above 93%, there is no need for oxygen supplemental need, and we're just gonna have to spot check with their vital signs and for further respiratory treatments if the patient's respiratory status is getting worse.
Alright, I'm gonna explain to you how to use a pulse oximeter. Pulse oximeter is some sort of a clip. So you open the clip, then put your finger inside the clip, and you will see on the meters the saturation of the oxygen and the beats per minute of the pulse. So the percent of the saturation of the oxygen, the blood, is 97%, and the beats per minute is 72 beats per minute of the pulse.